Hey everyone, and welcome back to the getwellbe podcast. This podcast is designed to help you learn, expand what you thought was possible, and become as empowered as you can be in your health. Thanks for tuning in for the 7th season of the getwellbe podcast. I hope you've been enjoying our first few episodes, investigative guides, and our latest getwellbe wrap-up so far this season. Today's episode is a conversation with Dr. Valencia Porter, an MD who is double board certified in general preventative medicine and integrative medicine, and who practices at Deepak Chopra's center in San Diego. Dr. Porter has become an expert in environmental medicine and recently wrote a book called Resilient Health: How to Thrive in Our Toxic World, a handbook for the toxic age based on her research, clinical experience guiding patients through the Chopra's signature detox program, and her personal healing journey. She was a conventionally trained physician who expanded her training to include integrative and environmental medicine after becoming quite sick herself with chronic Lyme disease. And her healing journey showed her that true healing from that particular disease was not found in the conventional system. Dr. Porter received her medical degree from USC and her master's in public health with a focus on environmental medicine at UC San Diego. Before we jump into this amazing conversation, unless you're driving, then don't do this. But otherwise, if you're holding your phone and haven't yet left the getwellbe podcast a review, please do it now. It takes less than a minute, and if you're getting anything out of the getwellbe podcast, this is your way to tell me. Thank you so much for the review in advance. Thank you for listening to the getwellbe podcast. And now let's dive in with Dr. Valencia Porter.
Valencia, thank you so much for being here.
Thank you so much. I'm so excited to speak with you today.
Well, I'm so excited to have you. We connected years ago and shared, both of our experiences with chronic Lyme disease and how that really changed our career paths, I would say, and kind of how we wanted to help people, which we'll talk about a little bit more. You have done extensive work on environmental medicine as well through your research and obviously what you also do with patients. So we'll talk about that. But first of all, what happened in your life? I know, but please share with the getwellbe community what happened in your life to make you want to pursue both, conventional medical training and then also integrative medicine.
Well, I think it's probably always been there lurking in the background. But I grew up as like a sciencey kid and was super into science and went to a magnet high school and pursued computer science actually as an undergrad, and initially started my career in pediatrics and child neurology. I was very interested in optimizing brain function and getting people to perform optimally and enhance everybody's well-being. But as a conventionally trained Western practitioner, I kept coming up to roadblocks because the only tools in my tool belt were pharmaceuticals along with their side effects. Meanwhile, so this was back in the early 2000s. Meanwhile, my patients were coming to me asking about, well, what about this gluten-free diet? What about homeopathics? What about osteopathic manipulation? And from that conventional Western standpoint, I didn't know much about it. I asked my colleagues about it and they were like, oh, it's unscientific. We go by evidence-based medicine. And so at the time I was saying, well, I don't really know much about that. But then as patients can be very resilient and proactive, I saw them go off and do it anyway. And they would come back and some of them were improved. And I said, hey, I got to look over there and see what's going on because they're getting results. Whereas on my last month of service, I was dealing with 3 kids who were getting conventional treatment, appropriate conventional treatment. However, the side effects were so bad that they ended up basically almost in a coma from being over-medicated. So that just broke my heart. And I thought, I can't continue to do this, just continuing to feed pharmaceuticals to kids without, looking at what other options there could be that may be less harmful and more helpful. So I took a step away and I dove deep into all of the different modalities. And, I just keep exploring because I want to get the best results for my clients with the least amount of side effects and hassle.
Well, that's an incredible story. I mean, it's just more of an incredible journey and realization that I think so many conventionally trained doctors are still stuck in this. I don't know. It's almost like a wave they can't get out of, where they know one thing. They have one thing in their tool belt. They keep trying to use it, but they're not really getting anybody healed. And it takes a lot of courage, I think, to step away from that after so many years of training and so much money and time invested to do something a little bit different. On your website, you have a great post detailing the reasons why you wrote your book, Resilient Health. Can you briefly talk us through that and explain, why you felt like the information in your book was so important and what led you to write your book?
Yeah. So along my journey, I had my own health challenges as we started to talk about. First, I started out with a back injury, and then eventually I ended up with chronic Lyme disease, which was probably triggered by a silver filling that was in my mouth that fell out after, many years. I had it since childhood, and I accidentally swallowed it. And so developed a mercury issue that, there was a cascade of events. So at that time I was under a lot of stress. There was this mercury, and then who knows what else, but I ended up developing, horrible symptoms that nothing was fixing. So in my quest to heal myself, I was looking at, well, what else? And as you might know, when you have Lyme disease or other biotoxin illnesses, if you have a toxic load, so from other toxins, that can impede your healing. So it was a personal journey for me. And also I was in the midst of helping people at the Chopra Center, and we would see them. And I'm also trained in Ayurvedic medicine, which is an ancient form of medicine from India. And we would lead them through a gentle detoxification. And from a Western standpoint, so going back to that Western training, we're taught that if we have functioning liver and kidneys, that's all the detoxification that we need. You're done. Like, why do you need to detox? That's, completely bogus. However, I kept seeing people come in, and then after, 6 or 10 days of doing these gentle detox therapies, supporting their nutrition, working on their mind, body, spirit health, they were leaving turned around. They were leaving so much better. And I wanted to learn more about how, what is this ancient detoxification practice and how is it helpful? All at the same time, I also, started studying. I have a master's degree in environmental health as well. So I recognize that my medical training, for toxicity, we learn about poisonings and we learn about occupational exposure. So people who are, work with asbestos and things like that. But we didn't learn about this chemical soup that we are swimming in, because since World War II, as a society, we've released more than 84,000 new chemicals into the world with very little testing. And if there is testing, we have tested only on like that one thing, one outcome, not this soup. Like, we are exposed to stuff in our water, stuff in our food, stuff in, what we're putting on our skin, in our clothes, in our home furnishings, in our cleaning products. It's everywhere. And at these low level doses, sometimes high level doses, but we don't know what this whole effect is on our system. So I wanted to learn more about how the system worked, because I saw the results that people were having when they did these cleansing practices. And so, it was really a deep dive for my clients as well as myself, really trying to understand. And here in Southern California at the time, juice cleansing became the rage. So people were doing detox, but I was also seeing people who were having issues with detox, perhaps not doing it right, not understanding fully what it meant, and potentially getting into trouble. So I do mention a couple of cases, I think, in my book about that, where, people thought that they were detoxing right, and they ended up doing a little damage or a little harm by doing it incorrectly. And so there was a lot of stuff on the internet at that time, a lot of stuff that wasn't necessarily true or incompletely true. And so I wrote the book to really be a resource and a handbook for people so that, number one, they could understand what are these toxins that we're exposed to in the world. Number two, what is the impact that it might be having on their own health and physiology? And then number three, what to do about it.
Okay. So of course, I have so many more questions related to environmental medicine and environmental toxins. It's something that, as part of my work with getwellbe, has surprised me over and over how much of an impact it has and how much, of an impact inflammation and this high toxic burden has on people's ability to heal. And it's just such an easier place to start, I think, than a lot of other things. And I say easier in the sense that, you can go through ingredients and products and throw products out. It's a lot harder to overcome childhood traumas and do a sugar detox where your microbes are fighting to stay, your bad fungus is fighting against you, and it's really hard. And, there's all these things that are really challenging about healing chronic health issues. But I think swapping out your deodorant is seemingly pretty easy, right? So I want to dive into all of the environmental toxin stuff that you've studied through your master's degree and also through writing your book and your work with patients. But before you do, we mentioned briefly that you healed from Lyme, and there's a large Lyme contingent in the getwellbe community. So if you wouldn't mind just sharing kind of a brief version of your illness and how you overcame it, I think that would be helpful.
Oh, wow. Yeah. So I grew up on the East Coast. I was a nature girl. I was always outside camping. And I know that I got bit by a tick on the East Coast. It was before I was in the medical field. And so I didn't know. I took it off wrong. The head was left in my body. And it was actually in college that I started developing some weird neurological symptoms. And it kept happening. And eventually they worked me up for multiple sclerosis. And they said I did not have that, but they didn't know what was going on. And bye-bye, good luck. So somehow I just soldiered on, I guess. And the symptoms diminished. I was having episodes where I couldn't move and episodes where I couldn't move my legs and episodes where my vision would go out. I would pass out all the time. So, some of those went away or diminished. But then when this mercury and high stress level triggered everything, then everything came back with a roaring vengeance. And I developed arthritis symptoms, weird, strange, like moving around in my hands and then my wrists and my elbows. And I thought maybe I was texting too much. So I stopped texting for a while. And I was like, what is this? And I had access to many of the best healers around. And so I felt like Humpty Dumpty. I was going around. I was like, oh, all the king's horses and all the king's men couldn't put me together again. I just kept going and searching. And finally, I thought I might have a strange autoimmune, like connective tissue issue, because my sister had connective tissue disease. So I went to see a rheumatologist and he ran the tests and he said, you have Lyme and Bartonella. And I was like, what? I couldn't believe it. But then when I went back and I looked, I was like, yeah, that totally makes sense. And so, as you know, and your community knows, it can be hard to diagnose, hard to treat. And my understanding at that time was, I had seen a lot of patients who had chronic Lyme and just how sick they were. And so I was determined to get rid of it. And I wanted to get rid of it fast, which, as you probably know, doesn't happen. But good intentions, right? So I blasted my system. I would not advise doing this to most people. But I was like, get this bugger out of here. I do not want this. I do not want this. I do not want the consequences of this. I had 2 young children at home. I was working a lot. So I took time off from work. I actually First, I took a month off, then 3 months. Then I was like, oh, it's going to be 6 months. It ended up being a full year. Yeah, I really just had to focus on healing myself and healing my my whole system. So every single system had fallen apart. And so in order to heal, I really needed to build up all of my systems to support the healing. So it was really a multifactorial focus on every aspect of healing, as well as blasting the Lyme. So I did antibiotics. It was, I had just learned about how important the gut microbiome was, and felt like I was like, oh, this is good. I'm doing good things for my gut microbiome. And then I was like, oh gosh, I'm going to just destroy all of that. So it was reluctant, but I did it. I also did a lot of herbal treatments as well. So I probably hit it with everything that you could hit it with. Yeah, it was not a joyful experience, but I am grateful to have come through on the other side and to have regained my health. And I actually, feel like I'm healthier than I was 20 years ago.
That's great. So you did antibiotic therapy, it sounds like.
Yeah.
Was it long-term?
Months. Multiple different ones. I can't even tell you how many. I have a journal that I have not, I've glanced at, but I haven't studied in detail that, shows what I did. And so it was multiple different antibiotics for months.
Oh, okay. And then you also did herbal therapy, and it sounds like you were maybe also doing some detoxification activities.
Oh, yeah. Lots of detox.
Anything else? Because this is a question I get so often, like, what should I use? And there's so many different things that people use, but it's really individual. So it is so individual. And also because, the ticks are dirty, and so they carry other organisms in addition to the Lyme. So then you have to address whatever co-infections you have and whatever other previous chronic infections may have been activated as well, such as, Epstein-Barr virus or, the herpes virus family. All of these things can be reactivated. There's also an interaction with mold. And so that was a big concern for me as well. And just really supporting the system. So I did a lot of work to identify what my body needed. What did my body need to? Oh, my thyroid fell apart too. And so supporting the thyroid, which came back, yay. So reversing that, the thyroid hit. But I had to really look at every single system and rebuild every system. That's what I would say to people is, figure out what's broken for you personally, and then work to rebuild that. And it might be, starting with nutrient support. It might be supporting your immune system. It might be looking for other toxins as well. And that's part of when I really got into the toxin work, because I thought, I had seen so many people whose healing was blocked by these toxins that they didn't even know about. So that's when I really just started to take a deep dive and clean everything up that I could, so that everything was, working as smoothly as it could be. Okay. Yeah, that makes a lot of sense. Thank you for sharing your Lyme story. Each one is so, as I said, so individual, so unique, so varied in duration and severity and whatever, that I think it's always interesting to people to hear when somebody is able to successfully heal from chronic Lyme. But I do want to focus on the environmental toxin stuff, because you're just such a wealth of knowledge on this topic. While I have you, how did this, I think it was in writing your book, but also in your own healing, that it became a focus area for you. But what processes in your body are affected when you're exposed to various types of, let's say, pollution or toxins? And is there a simple way to explain how our bodies and our health are affected by these toxins?
A simple way. Well, so there's so many different types of toxins. There are pollutants that we think about. So things that can contaminate our food, our water, our air. So for like right now, what we're hearing about is like the Teflon family of toxins, the PFAS family. We know about organophosphate pesticides and glyphosate. And, those types of, toxins, poisons. And so all of them have different ways that they can affect us. There are also things that are natural in the environment, like mercury and lead and cadmium. They're natural in the environment. However, then they might get in our water, our air, our food supply, and at increased levels also impede our health. And then there are also toxins that we ourselves produce. So by our own body processes, for example, if you're dealing with a bacteria or a virus, your body has to take care of it and it creates a toxicity. When we metabolize things, foods that we take in, nutrients that we take in, sometimes we can create some toxicity. So there can be toxicity on multiple levels, and there are natural toxins, unnatural toxins. I think most of us tend to talk about those chemical poison toxins, but there are other things that we're just exposed to in regular daily life. And, getting back to what I said about, Western medicine saying if you have a functioning liver and kidneys, it's all good. You don't need to worry about it. I would say that perhaps that was true 100 years ago. But now we have all of these added toxins, plus invisible toxins like EMFs, electromagnetic fields that we're bathed in that now we're seeing are affecting our health as well. So they can have a multitude of effects. And part of what my job is as a clinician is to look for what it is that's affecting you. So if I see somebody who's having neurologic symptoms, I'm going to look for toxins that will affect the neurologic system. So for instance, mercury, lead, those will affect the neurologic system. Organophosphate pesticides, those will affect. So the toxin has to fit the clinical picture in front of you as well. And I might run a whole toxin panel and look for things. So there's a lab that I use, Great Plains Lab, and you can do a toxin panel and look at a whole wide array. And sometimes I'll find surprising things for people, but it doesn't match their symptoms. So I'll alert them, but that might not necessarily be my focus at that point in order to help them get well in that moment. I'll say, let's definitely follow up on this. And probably the detoxification suggestions that I'm going to give are going to take care of it. But let's focus on what is really making an impact on your health right now. So it can affect, any system. We have toxins that affect the reproductive and endocrine system. And I'm super concerned about those because those can hit us at micro levels. If you think about medications, thyroid medications, hormones, birth control pills, all of those are dosed at the microgram level. Small levels can have powerful effects. And I think that's, maybe part of the shortcomings of the evaluation of these toxins when they're actually evaluated is that they might look at a certain dose and not look at the micro dose and what effect that potentially has. So we're seeing that many of these endocrine disruptors, they're called endocrine disruptors, plastics, glyphosate, they can have these effects, and those might have effects at certain time periods in development as well. So I'm really concerned about our kids, especially as they develop and grow. And we're seeing things in the natural world. So people that have done research on animals and showing that things are changing in terms of, these reproductive hormones, thyroid, all of these things are being affected. So they can affect hormones, they can affect, your nervous system function, they can affect your immune system. And some toxins have multiple effects as well. So really, it's such a broad scope.
We'll be right back with Dr. Porter after this quick message. I don't know about you, but I never listen to the end of a podcast, so I'm hopping in here to let you know that the best way to stay empowered and on top of your health is to be in the WellBe community. So head to getwellbe.com/subscribe to make sure you're in like Flynn. On getwellbe.com, you'll learn about my private holistic patient advocacy work, my programs to help you go deeper and make life-altering changes to your health, and our awesome non-toxic product database. If you're more of a social media person, let's be friends on Instagram. Find me at getwellbe and be sure to press follow. Okay, now back to our enlightening conversation with Dr. Valencia Porter.
You mentioned things like mercury and mold and plastics, and I think they affect every system a little bit differently, and they affect every human a little bit differently. But, from working with patients and also your research, are there any that stand out as like overwhelmingly present in people that also have chronic illness? Like, is it, do you usually find high mercury or mold toxicity or, high levels of PFOA or whatever? Like, is there one that stands out to you as like, oh, it's always there when there's this health problem?
There are some where I'm like, ooh, I have to look down this pathway. Another thing that's concerning me a lot is mold, because it can have such devastating effects, and it can affect your immune system, your nervous system. People who are holding on to weight for no reason. I'll often see that. People who are like, I can't lose weight. I'm eating the right thing. I'm exercising. People think I'm lying. I'll check for food sensitivities and I'll check for mold. And it's usually one or the other, because mold is sneaky. You don't necessarily have to see it to be affected by it. And different people have different genetic susceptibilities. So two people living in the same environment might have totally different effects as well. So to me, mold is really sneaky, with all these superstorms that have been happening, with people getting, living in water damaged buildings, water damaged offices. You might not know. Water damaged cars. If you buy a used car, you don't necessarily know if that car has been flooded. And then even in dry climates. So like, in Arizona and the desert, you got your air conditioning unit, which that can grow mold too. So it's like no place is safe.
I've seen this a lot with my private patient advocacy clients. It's something that I tend to, part of my work is usually helping them find a functional integrative doctor who can really investigate their symptoms and figure out what's really going on under the hood. And if somebody's not mold literate or doesn't think of that, I usually don't advise working with them, because I think it's something you really have to rule out, because it is so common, especially when, like a chronic Lyme patient or an autoimmune patient. It's like there's something else going on there. And usually mold is that lovely cousin right there.
Right there. Yeah. And, also with mold, there's just so many different effects that mold can have as well. So, it looks different in everybody. And Western doctors, conventional doctors, really only suspect it when there's an allergy or a respiratory issue. So it's really an invisible illness. It's not acknowledged. People also, don't even believe that it's true, which is really sad.
Yeah. So the best ways that you mentioned testing for mold are usually through something called Great Plains Laboratory. And then correct me if I'm wrong, but it's really local and pretty annoying to figure out how to best test your house for mold, right? There's a number of different kind of like price levels of mold investigators. And is there any one, resource that you use that you feel like is really good for finding quality mold inspectors?
Yeah. So for personal, like figuring out what's going on with you, I use Great Plains as well as real-time labs. So those are two labs. It's a urine test, and you can see what's going in your body. Now, for local testing, like checking out your home, I would recommend working with, number one, just a testing company. So not a remediation company, because there's a conflict of interest there. If somebody's going to do the remediation, it's like, oh yeah, there's mold there. Let me fix it for you. So just a testing company. And I look for somebody who's certified by IAQA.org. So it's, I think, the International Air Quality Association, IAQA.org. So those are professionals who are trained in air quality. And they have a Find a Pro link on their website. or somebody who is a certified building biologist.
That I've never heard of. Wow.
Yeah. So
Building biologist. Okay.
Yeah. So people who are certified building biologists would also know about things like EMFs, if that might be a concern for you as well, other factors.
Got it. Okay. Is there a way to easily tell if you don't have symptoms, but you just want to be sure that your exposure level to things like, plastics, and because we can't escape plastics, right? I mean, you can't shop at a grocery store if you refuse to use any plastic. It's just, unfortunately, a little too pervasive. There are ways to dramatically reduce the use of plastic, which I, have done myself. I use metal and glass for drinking water and things like that, but very hard to completely eliminate it from your life. So is there a way that you recommend people could tell their kind of exposure level and to see if they're over a limit where it's actually harming their systems and their ability to detoxify, or if it's kind of below a level where your body can, quote unquote, handle it?
Yeah. So there's so many, potential chemicals in the environment that we could be exposed to. But again, Great Plains has a really wonderful GPL tox test, which is also a urine test that I can use as a screen as well. So people who come to me who just want health optimization and they're like, I just want to stay healthy and be as healthy as possible and go into my aging years in as good shape as possible, I'll recommend that they do these, so that they see, what the levels are and where their exposures may be. But it doesn't test for everything. There are other things that also you can look at, to gauge a person's, health and well-being, which I also, might look at as well. So how well is their immune system functioning? That might be impacted by toxins as well. So at this point, looking at environmental testing that's available to consumers, so not in a research lab, there's not too much, unfortunately. But that's a good start. And usually when I run that on people, we find something. I just had one person who I was like, oh, you are pretty darn clean. So that was amazing. I was just congratulating that person. And they had just, kind of lower background levels, nothing too concerning. But that was rare. That was like 1% out of everybody that I've tested. So it's hard. It's really hard because we are exposed in so many ways all throughout our day. I think when we know, so if we test, then we have a better idea of where we can focus. So it can be overwhelming.
That's exactly what I was going to say. Normally, I'm sort of like, only do testing when you feel something, because you can kind of go crazy with it, especially with all the different functional medicine, like specialty lab companies that are out there. I mean, there's so many things you can test for. At the same time, there's a lot of things to focus on in life and with regard to your health. And nobody makes successful changes by trying to do 4 things at once, right? You kind of have to like really focus on a meditation practice to nail that. And then really focus on exercise. You try to do all of them and you haven't been doing them. It's very hard to get new habits to stick. But if I knew that I was higher than I thought on the environmental toxin level, like I would be much more motivated to get a mold testing company in my house, or do another sweep of my personal care products, which I think are at this point pretty clean, or, things like that. So I do think that's a great idea for somebody that just wants to kind of check the box to make sure that they're not at risk of, letting these things become issues. But again, everything costs money. So
yeah. And that's what I love about, functional medicine. It's, test, don't guess. And to me, functional medicine and Ayurveda really go well together because both of them look at the whole picture. Both of them really focus on prevention as well as regaining health. But Ayurveda, that was developed thousands of years ago. So there's no testing other than post-diagnosis and physical exam. So to me, with my clients, I have found that it's sometimes more motivating if they can see a test result and they know, ooh, that's really high. I got to do something about it. That is really motivating versus me saying, oh, yes, your liver pulse is high. We need to focus on detoxification. Just generally, it's for some people can be a little bit more difficult to grasp that concept and the need to really focus on those areas. But Ayurveda also, what I love about that. So Western medicine will catch you at the end, right as you're falling over and getting a diagnosis. So you have to have completely fallen off the rails. Whereas Ayurveda and functional medicine, we can pick things up before you develop a full-blown clinical diagnosis. And that's what my focus is as a preventive health expert, is how do we keep you on this side? How do we keep you well instead of waiting until you're diagnosed? I just had some frustrating interactions, supporting my family members and, clearly seeing like, okay, they're heading down this pathway, and the physician saying, well, we're just going to watch and wait. I'm like, that's wonderful for you. We're going to just go watch and wait until I fall over into the pit, and then you're going to try to rescue me out. Why don't we try to keep you out of the pit in the first place?
Right. And also, I hate to go to a dark place, but the physician makes a lot more, right? If you're in the pit and you really need all the different services that they would then offer. So the system incentivizes them to watch and wait, right? Which isn't great. So I completely agree with you. It's much easier to get somebody away from the cliff than it is to try to go rescue them once they've fallen off of it. But on that topic, what are some of the most effective ways that you've seen to help people reduce their toxic burdens, like specific different therapies or even types of herbs, if that's something that you use, or if it's a breath work practice or meditation practice or something like that?
Mm-hmm. Yeah. So for me, food is medicine, and that's the primary focus. If you are eating toxic foods and foods that don't support your whole detoxification process, it's going to be hard to get off of that cliff. So really working on supportive foods. So we need protein, amino acids to help support our process. We need vitamins and minerals. So really nourishing, healthy foods, greens, leafy greens, and cruciferous vegetables in particular. Those are super detoxifying. So really focusing on the foods and supporting the gut microbiome. These microbes that live with us also help us to detoxify as well. So if we have some imbalances in our gut microbiome, that can even play a role. What I learned was some of these microbes help us detoxify from mercury even. So super cool stuff, these little bugs. And then, these foods also support our liver. So they activate the liver, and there are certain herbs. You can think of turmeric and garlic and onions and rosemary, thyme, all the herbs and spices. Not only do they taste good, they're medicinal. I love, culinary medicinal herbs. I think it's fantastic. Green tea too. That's great. So really focusing on the foods, focusing on drinking clean, pure water, because, our kidneys also help us to detoxify. So we have water soluble toxins we need to flush out through our urine, and then fat soluble toxins that need to get converted by these liver processes. So supporting the liver and not stressing the liver out too much. So, reducing things like alcohol, which, I'm like, do I want my liver to work on processing the alcohol that I just drank or the caffeine that I just took in? Or do I want my liver to be supporting detoxifying my body? Because, when you have limited resources, where do you want the resources to go to? So we get rid of toxins through peeing, pooping, sweating, and on our breath. I tell people, I'm like, make sure your exits are working properly, because you could do all the right things. And then if you're constipated and not going to the bathroom, that could be a real issue, because those toxins actually can then get retaken up back into your bloodstream if they're just sitting there. So making sure that you're having a good regular bowel movement daily, if not more, is good. And then also, what's going on your skin. So making sure that what you're putting on your skin is clean. 60% of what we put on our skin is actually absorbed through our skin. So we have to pay attention to those ingredients. And I'm glad now, like sunscreens, it's summertime now, there's more awareness about things that are in sunscreens, because that's been a problem, and not only a problem for us, but also a problem for the creatures that live in the ocean. as well. So I know like Hawaii just banned a bunch of sunscreen types. So paying attention to what's on your skin and then making sure that you are cleansing your skin. So skin brushing, which also helps with lymphatic drainage. So our lymph system also helps to cleanse our body. And then sweating. It's good to sweat. I know a lot of people don't want to sweat, but it's so good to sweat. And if I have a client who they're like, no, I never sweat. I'm like, oh, that's a problem. You need to sweat because some of these toxins are released through our sweat as well.
Before you move on from sweat, I have a quick question. I heard a myth that if you go for a run and you're soaking wet with sweat and you just, sit down and eat something and look at emails and whatever, and 2 or 3 hours go by and you're like dry, did those toxins get reabsorbed into your skin? Do you need to wash them off quickly?
So I'm not sure if there's a scientific study on that, but what I've heard is that they can be reabsorbed because, I just said what you put on your skin is absorbed. So if you let it sit, it's reabsorbed. So if I'm telling somebody to, do a sauna therapy, I'm like, bring a towel in and keep wiping yourself off because you want those to go in the towel, not back onto your body. So same thing. If you work out, I would wipe off or rinse off quickly and then grab a bite to eat instead of just letting it sit.
I was giving my brother a hard time about this exactly yesterday. So I'm very glad that I now have you to back me up on this, making sure that he rinses off and towels off quickly because he tends to sit in sweaty clothes for hours afterward. So what are the most common symptoms and trends that you've seen with your patients and in your research that are indicative of certain kinds of high toxic burden? So are there any particular symptoms where as soon as you hear of one, you're like, I think that's related to a high toxic burden rather than just, gut dysbiosis from something else?
Well, I think for me, a lot of the autoimmune illnesses, I feel like I have to look there. And autoimmune illness has been on the rise, not only in adults, but also in children. And so just kind of looking at the trajectory, I'm like, what is going on? Why all of a sudden? And I remember early in my practice, I was like, why does everybody have thyroid illness? Well, I was like, every single one of my patients has a thyroid issue. Why is that? And I think part of that is our environment. And part of that is our gut and our food. So I think those are all kind of interrelated. So definitely when I see people with autoimmune illnesses, people who have strange symptoms or things where they've tried the conventional approach and it didn't work, or they didn't get better, or they had incomplete results. I used to joke because the Chopra Center was on this beautiful resort. And I said, I'm a resort doctor and I'm the doctor of last resort. So oftentimes people will have come, if I see somebody and they have gone to 10 or 11 other doctors, I'm going to look down the toxin pathway.
A lot of conventionally trained doctors don't use those specialty and functional medicine lab testing companies like a Great Plains that you might use, for example. And so they might run what a patient thinks is, all the blood work, right? I've been tested for everything. I've heard that a lot, as I'm sure you have, but not necessarily on this toxin side. So this is something that you would do, but also somebody needs to be able to read those results. So it's not something that a conventionally trained doctor who's never used it before should do, right? Because then they can't interpret the results very well.
Yeah. And they would look at it and be like, I don't know what this is. Throw it in the garbage. So
it's not only important that people understand that they can do toxin testing through these specialty labs, but that they work with somebody like you or, somebody else who really knows how to interpret them, because it's not just having the test done. It's also what you then do with that information, right?
Yes. Yeah. And understanding what it means for you personally as well. Yeah, that reminds me, another category of people where I'm thinking about toxins is, labs normal, feels like crap. So they went to the doctor, they feel horrible. They ran a bunch of labs. They told them, your labs are all normal. Here's your prescription for an antidepressant.
Yeah. And then that's when you would go to all of the different toxin testing, or you would just sort of narrow in on some of the biggest offenders, like we talked about, maybe mold first and that
So
kind of stuff?
for me, I really do personalize everything. So I don't generally have a panel that I run, except for now. So I am trained in the Bredesen Recode protocol, which is reversing cognitive decline. Dr. Dale Bredesen was an Alzheimer's researcher for like 30 years, and he came to understand that it's not one molecule, one issue, one drug. So he really took it to a functional medicine approach and has published some research on his approach and how successful it is at sometimes reversing, but at least preventing further decline, and kind of stabilizing people. And with that, because it's so complex, and you're dealing with a brain deterioration situation, in those cases, I do have a big panel that I will run. But it's a big panel. It's a lot of labs.
Right. I mean, and that makes sense to me, right? Because if the toxic burden in your body has reached a level in which your brain is now full of plaque and this other stuff, I mean, time is of the essence. Like, you really need to understand all the things that are going wrong and deal with all of them, not deal with one and then a year later test for another and deal with that. Like, you really have to pull out all the stops versus somebody who just has some fatigue, perhaps, or something like that, where it's like you don't have to.
In that case, with fatigue, I'm gonna triage it. I'm gonna look for the things that I think would be most likely for that person, the most likely things. And then if those don't pan out, then I'm going to look for like what we call the zebras, the unusual things.
Right. Yeah. It's funny. That's kind of what I do before I get somebody to somebody like you, because I want to make sure that whoever I send a private client to is versed in those things, right? If I really believe there's candida and the doctor has no experience with candida, then I'm not interested in that doctor. So it's kind of a funny, like, we're both thinking in the same way as investigators, but I'm just like doing it ahead of time. This has been incredibly helpful. And just, in summary, given all of your research and obviously writing a whole book on this topic, and then obviously all of your patient work as well, I know you would say we're living in this crazy chemical soup, and it's largely unavoidable and very untested, unresearched, and scary. So, what are the things that you think about for yourself? I know you mentioned clean water and, cleaner personal care products, but just, is there like 4 or 5 things that you're just like, these things make a huge impact, and I'm really focused on them in my own life to try to reduce this chemical burden so that I'm not just another statistic of, this chemical soup.
Yeah. So like you mentioned, clean water. I would also say breathe and relax and trust, because if you're in a situation where you have to get a plastic bottle of water, otherwise you'll be dehydrated, get that plastic bottle of water. Like, I would rather it not be plastic, but you have to hydrate. So clean water, great food, nourishing food that you enjoy. Like, we should get joy out of our food. So organic, clean, things that are going to be sustainable for our environment also. And then looking at our personal care products, our cleaning products. I would say fragrance. We don't know what that is. If it says fragrance on there, I'm putting it aside. I'll use natural, like essential oils and natural fragrances. But if it says fragrance, that means we don't know. And then I'm reaching the age now where the creams and personal care products, where like I'm slathering on a lot of stuff. So I'm paying attention to what I'm using, because I've seen people get in trouble in that way, because like there was one ingredient that they weren't paying attention to. And that happened to be something that pushed the lever for them into poor health. And then air quality, which includes mold, dust, and general air quality. If you're able to open your windows and get fresh air, if you live in a non-polluted air environment, that's wonderful, and getting outside and breathing, so important. If you can, breathe in that prana, the energy of plants, it's so impactful. So those would be my biggest ones. And, being mindful and meditating is great too. So those are good things.
Absolutely. What do you suggest for people that have identified that they live in an area that is kind of unsafe, but they are, for whatever reason, financially or family related, like not able to really move right then? Like, for example, they live maybe too close to a highway, or there's a chemical plant too close to their house that they didn't know about. Something more related to the air quality where it's like, shoot, I know I need to make a change, but I can't do it right now. Like, what can I be doing to try to minimize this damage?
Yeah, that's a tough one, and it probably depends on the person's own physical health and robustness. If they're able to get an air purifier, at least a HEPA filter, although for some of these chemicals, it really has to be a very small filter or special type of filter to deal with some of these chemicals. But, you have to do what you can. And that's part of it too, is controlling what you can. What do you have control over? So maybe you don't have control over the air around you, but you can control what you eat and make sure that you have good nutrition and that you're supporting your detoxification system. So even if you're exposed to, chemicals, which may be causing what we would call oxidative stress. So a lot of those fruits and vegetables, which have all those wonderful colors in them, have antioxidants. So I would say, focus on your food, as much as possible, get in fresh fruits and vegetables, colorful, natural colors, organic preferable, but if you can't afford it, just get those fruits and vegetables in. So I'm partnering with some people to try to make organic, sustainable food affordable and more accessible to people in urban environments, which are kind of like food deserts, because I think that's a huge problem and really would make an impact on people's health.
Yeah, no, I think that's a huge important thing. A lot of people have maybe heard of antioxidants, right? But an antioxidant is basically something that helps you detoxify.
Yeah. So you don't necessarily have to take a supplement. You can go eat an apple.
Exactly. And like, there's so many antioxidants in our food, depending on the food that you eat, that you can start there without having to, spend a lot on a lot of additional supplements. Cause, I know plenty of people who have a diet full of processed food and sugar and then throw on a lot of supplements and herbs on top of it to try to somehow make up for it. And it's like, just start with that, and then you won't need as much of that. So
exactly.
Thank you so much for this, Valencia. Can you please share with the WellBe community, if they would like to pick up a copy of your book or work with you privately, or what, where people can find you?
Yeah, so my website is my name. It's valenciaporter.com, VALENCIAPORTER. And the book is available on Amazon in print and ebook.
Okay, great. Well, I know that you are just a wealth of knowledge on this topic, so I hope you keep, writing books and putting the research that you've done out there on environmental medicine and the impact of these environmental toxins on healing chronic disease, because I've learned how important it is, but it's still very, very new to people and really hard to grasp that, filtering their water and not using the high-end blush from Chanel or wherever that they've been using for decades is really going to make that big an impact on, say, their fertility or their period issues or their cognition, their, ability to prevent Alzheimer's. And it's such a hard concept to grasp, but having people like you on the WellBe show and podcast to talk about it, I think really helps to make it more clear.
Thank you.
All right. Well, have a great rest of your day. Thank you again.
Thank you so much. Great speaking with you.
So that's all for this amazing conversation. Now, I'd love to know, what's an action you can take now based on what Dr. Porter shared? Perhaps it's looking through some of your personal care products or looking up where to get an infrared sauna near you. Or maybe it's looking into a blood panel to see what your toxin levels actually are. No matter what it is, head to getwellbe.com and check out the WellBe non-toxic product database because it's one of the most helpful things out there with regard to reducing your toxic burden with everything you buy. Oh, and our accompanying Spark Health program takes you through the process of detoxifying everything with your lifestyle and your home. So it's a great way to make sure that you actually make the changes. Also, while you're there, become a WellBe Insider so that you can get all of our latest content, special offers, and personal notes I don't share anywhere else weekly in your inbox. Plus, you'll get a free copy of my audio guide on how to feel the best you've ever felt and heal anything. The 10 things you need to optimize your health and heal any health issue, big or small, naturally. Even if you're the healthiest person out there, I promise you'll learn something you didn't know that can help you to optimize your health. If you haven't already and found this episode helpful or interesting, subscribe to the podcast. This way you'll never miss a new episode and they'll be delivered to you whenever we publish a new one. And please share this episode with family or friends you think might find it valuable and informative. It means a lot and helps more people find the podcast. If you already have, then thank you so much. I really appreciate it. This is your host, Adrienne Nolan-Smith, and thanks again for listening to the WellBe Podcast.